Access to health care. You've probably heard some of the ongoing debate over what's called the Big Beautiful Bill. It's sweeping legislation that President Trump wants Congress to pass by July 4th. By the way, that's a week from Friday. It's coming fast. One part of that bill has raised bipartisan concern. What happens to Medicaid? It is the insurance program 1 in 5 Americans rely on for health care. The House version of the Big Beautiful Bill reduces federal spending on Medicaid by about $800 billion over 10 years. The Senate version cuts even deeper by limiting the taxes imposed on providers that helps fund the program. Republican Senator Josh Hawley of Missouri is one of those opposed to such deep cuts.
Very different than what the House negotiated with the president. It's different from what the president negotiated. I can't figure out why in the world we would so radically depart from the president's own framework.
And here's the concern. Cuts to Medicaid will hit rural areas harder. 23% of all Americans living in rural areas are covered by the program. And that number, you see it here, it's about 50% when you're talking about children. Those Medicaid payments for service helps keep rural hospitals open. And keeping them operating, that has been a struggle for years. Data compiled by the Sheps Center at UNC Chapel Hill found that in the last 20 years, 195 rural hospitals have completely closed or stopped providing inpatient services. Same center says another 338 will be at risk if these Medicaid cuts go through. And you can see the map right here. 5 of those hospitals are in the state of North Carolina. You got another 5 in South Carolina. And one of them there on the list is right here in our area, MUSC's Chester Medical Center.
Chester Medical Center is the only hospital in Chester County. It's a county of about 35,000 people. No hospital in the county directly to the south, and then one has to travel up into northern York County or into Columbia or east to Lancaster for care. So it's quite a ways for some residents to travel for care if Chester Medical Center didn't exist.
Which is obviously a big deal in an emergency, and it's just a pain if you don't want to use up a whole day for something more routine. That, by the way, was MUSC's regional CEO, J. Scott Broom. We went deeper into this Medicaid issue and asked him if that health care is at risk in Chester County.
MUSC Health acquired Chester Medical Center, Lancaster Medical Center, and some others in 2019 and some others since then. As that occurs, we're able to take advantage of economies of scale and other things like that that help shore up the foundation of hospitals as compared to how they would operate if they were standalone. So I think we're in a strong position, we being MUSC Health, to continue to support the community of Chester.
So you don't think you belong on this list?
No, I don't feel like Chester Medical Center is at risk, given that it's part of a much larger whole.
The report puts you at risk because it points out 3 years of negative margins. What's leading to that?
Chester Medical Center operates close to break even, but kind of back to the Medicaid discussion, that's because Chester Medical Center in a rural county has a disproportionate share of Medicaid patients or either underfunded patients that we care for, and so those payments through programs like Medicaid are vitally important to us to keep a hospital like Chester Medical Center or many hospitals in South Carolina, frankly, functioning well.
So you point out being part of a larger system gives you a little more cushion, right, to handle this sort of thing. But is there a breaking point at some point?
Certainly there is. I mean, there's a limit to what a larger system can carry. And so it's important that we try to operate all of our hospitals within our system to the highest and best level of performance that we can. So, there certainly is a limit at some point.
Does this bill push you closer to that?
The bill would push smaller hospitals closer to that level of risk, but not only smaller hospitals. It would affect all of our hospitals the same. So there's a House version of the bill and a Senate version of the bill. The House version of the bill, at least as it is presently written, is more favorable and keeps much of the payment structure and methodology that we presently have in place. The Senate version does titrate that down over time. So hospital CEOs, I suspect across the country, but certainly in South Carolina, are staying very close to our hospital association and other entities like that, and trying to engage key legislators on the impacts of the House version of the bill as well as the Senate version of the bill, so that they understand how that impacts hospitals and their constituencies.
Those negotiations still ongoing in Washington. We will certainly keep you updated.